Hey everyone, my name is Drew. I'm 25 years old and I am almost 1 week on testosterone. I just kind of wanted to go over the process of informed consent through Planned Parenthood because I was totally unsure how exactly it was going to work and didn't have a ton of good luck finding super good reviews on exactly what the process was like. So since I just went through it almost a week ago, I figured I'd do a little info right now while it's fresh in my head. So first of all, I live in Portland, Oregon. There is one Planned Parenthood location that does informed consent. So you can actually go online and set up an appointment for the hormone therapy. So you don't even have to call or anything. And they say that without insurance, and if you're making like good money, it costs about $300, $350 for the whole appointment. I ended up only paying $75 because I'm unemployed, and I'd already had my blood work, so I already brought that in and everything. So we didn't have to do that, and it was only like a 20-minute appointment. So first off, they give you a bunch of paperwork. One of them, right here, estrogen and testosterone self-injection guidelines. It basically just explains how to take the shots and all that stuff, how to prepare, how to inject, all that good stuff. So that's really awesome that they hand that to you. The other paperwork that they give you is like the informed consent portion. So it kind of talks about what the hormones are, what they do, the benefits, the risks, the side effects. It also comes with, and I apologize, this is dirty, basically kind of like a timeline for estrogen and testosterone on when to expect different effects. So got some really cool information right there. I mean, of course, it's totally dependent on like you and your dose and your genetics, but it's just kind of an average and an estimate. The next page you get is basically a little more information about side effects, which side effects are serious, kind of information about what you need to tell your provider before you start testosterone. So if you have sleep apnea, diabetes, lung disease, if you're pregnant, obviously you probably don't want to start testosterone, how testosterone should be used, all that kind of stuff. So basically you get these 3 different forms. You have to read through all of them, discuss them a little bit with the doctor, and that is, you end up signing one of them here with the doctor's copy, basically giving consent to start testosterone. My doctor was really, really awesome. She basically was just like ready to give me a prescription, asked me a handful of questions. I mean, it was really quick. It went really fast because I'd already had blood work done in the last 6 months, so I didn't have to get blood work done there. I just picked it up from my doctor's office and took it with me. So the appointment was really, really easy. She didn't actually end up giving me a shot there. They don't fill it or carry it at their facility. So she just called it into my pharmacy. I went and picked up all the needles and syringes and the vial of testosterone there, and the pharmacist basically told me how to inject. The type of injections I'm doing are sub-Q injections, so it's done in the belly fat. The reason the doctor said she recommends doing that is that it absorbs into the body better, and you don't need as much as you do when you're doing it intramuscular. And it's a lot less invasive, typically does not hurt as much, which I can honestly say I didn't feel it at all. My partner gave me the shot when I got home later that night, and I didn't feel it. It was really pain-free, really easy. The needle's super short in comparison to the ones that are intramuscular, so it was pretty simple. I mean, other than that, that was really the whole thing. maybe start to finish, it took like an hour and a half at Planned Parenthood. And most of that was just kind of waiting in the waiting room and then also waiting in the back room for the doctor to come in. Planned Parenthood's really busy, and it's not usually a super, super quick process. But the appointment itself was only 20 minutes. And like I said, only cost me $75, which was really awesome. So, yeah. Thanks for watching my video. I might post more in the future. Let me know if you have any other questions or feedback or whatever. And hopefully this helps someone out. Take care.